About 40% of the world has hypertension, or high blood pressure, which basically means that it's pretty common. Let's start by defining it. Typically, it's represented by two numbers. The top number is the systolic blood pressure, which is the arterial pressure when the heart's contracting. And the lower number is the diastolic blood pressure, which is the arterial pressure when the heart's relaxing or refilling. Most of the time, blood pressure is taken in the brachial artery in your upper arm. Because if the pressure's high there, it's probably high throughout all of the arteries. The guidelines for categorizing blood pressure have recently changed to reflect a growing body of evidence that shows even moderately high blood pressures can significantly increase your risk for developing heart disease. Now, normal systolic blood pressure is defined as less than 120 millimeters of mercury, and a normal diastolic pressure is less than 80 millimeters of mercury. Elevated systolic blood pressure is considered between 120 and 129 millimeters of mercury, and less than 80 millimeters of mercury on the diastolic side. Stage 1 hypertension is between 130 and 139 millimeters of mercury on the systolic side, and between 80 and 89 millimeters of mercury on the diastolic side. Stage 2 hypertension is defined as anything that's 140 millimeters of mercury or higher on the systolic side, and 90 millimeters of mercury or higher on the diastolic side. Now, about 90% of the time, hypertension happens without a clearly identifiable underlying reason, and we call this primary hypertension or essential hypertension. In other words, over time, pressure in the arteries starts to silently creep up. And there are a bunch of risk factors that we've identified for primary hypertension, and these include old age, obesity, salt-heavy diets, and sedentary lifestyles. With the exception of age, all of these can be improved with lifestyle changes, and those changes can help reduce hypertension. Having said that, though, sometimes blood pressure remains high despite diet, exercise, and taking 3 or more medications. And in this case, it's called uncontrolled hypertension. One important factor that affects blood pressure is compliance. Compliance is the ability of a blood vessel to respond to an increase in pressure by stretching out to increase the volume of blood it can hold. Remember that arteries are stretchable tubes, like rubber hoses, rather than lead pipes. So if the blood pressure increases, the walls of the artery can actually stretch out a bit to accommodate a greater volume. And exactly how much they stretch out depends on their compliance. And a good way to visualize it is to imagine water moving through a pump with and without an elastic piece. With the elastic piece, the pressure's lower and the water flows more even. Without the elastic piece, the pressure rises and the flow becomes less even. This ties directly into hypertension because as we age, the arteries stiffen, and they start to act like the water pump without the elastic piece. So as we age, our arteries become stiffer and lose some of their elasticity. This gradual loss of elasticity might be the cause of hypertension in many patients. The ROX coupler is a small implantable device that creates a passage, which is also called an anastomosis, between an artery and a vein in your pelvis. This passageway allows a small amount of blood to flow from the artery to the vein and essentially restores some of the elasticity that comes from stiff vessels. Since the blood in the artery is at a higher pressure than the blood in the vein, most patients will experience an immediate reduction in blood pressure. The good news is that lowering blood pressure, even by a tiny amount, reduces the risk of cardiovascular disease. In fact, a recent study showed that for every 1 millimeter of mercury that the blood pressure goes down, the risk of cardiovascular disease and death goes down by 2%. So a 15 millimeters of mercury decrease would lower the relative risk of cardiovascular disease by 30%. And that data comes from the SPRINT research group published in the New England Journal of Medicine in 2015. Placing the coupler works like this. The coupler gets placed percutaneously, meaning that small needle-like punctures are made on the skin and thin catheters, which are like tubes, get inserted in the artery and vein of the upper leg. The coupler works by creating an anastomosis, or passageway, which allows high-pressured blood from the iliac artery to go into the lower-pressured iliac vein, which is in your pelvis. It's kind of like a diversion valve that prevents the blood pressure in the artery from getting too high. And most patients have an immediate reduction in blood pressure. The entire process should take less than an hour, but it requires an overnight stay in the hospital to make sure that you're okay. On the following day, the study team will make sure that the needle punctures are taken care of properly. They'll also monitor your blood pressure and get you ready to head home. Now, every procedure comes with risks, and placing the coupler is no different. Some specific ones to be aware of are narrowing of the iliac artery and iliac vein, blood clots forming, or serious bleeding. Some of these complications could require another procedure. Once the coupler is placed, it's meant to be permanent, but if need be, it can be reversed with a second procedure that covers up the opening between the iliac artery and the iliac vein, without actually needing to remove the coupler. Alright, as a quick recap, an important cause of hypertension is old age, because over the years arteries stiffen, and this decreases their compliance. To help reduce blood pressure, the ROX coupler device creates an opening between the high-pressured iliac artery and the lower-pressured iliac vein, creating a kind of diversion valve.